At this time, it is my distinct pleasure to introduce our keynote speaker, Dr. Judy L. Ashner. Each year for this ceremony, we choose a highly respected member of the faculty to provide insights, some of them quite personal, as to the process and pleasures of becoming a physician. This year is no exception. Dr. Ashner was recruited 2 years ago from Vanderbilt University Medical Center, where she was a tenured professor of pediatrics, to be the chair of the Department of Pediatrics at Einstein and Montefiore. Dr. Ashner received most of her professional education within the borders of New York State. She got her BS degree from Union College and her MD degree from the University of Rochester School of Medicine. She continued at Rochester for her pediatrics residency and a neonatal perinatal fellowship before moving to Albany Medical College for her first faculty position. She is an internationally recognized leader and physician scientist in the fields of pediatrics, neonatology, and perinatal biology. Her laboratory and translational research focus is the regulation of newborn pulmonary circulation. Her work has helped elucidate factors that contribute to altered lung development and pulmonary hypertension in infants with lung and heart disease. Her clinical interests include prevention of chronic lung disease, treatment of infants with pulmonary hypertension, optimizing nutritional management of premature infants, and prevention of prematurity. Dr. Ashner has served in a number of leadership roles, including Secretary-Treasurer of the American Pediatric Society, founder of the Tennessee Initiative for Perinatal Quality Care, chair of the Organization of Neonatology Training Program Directors, member of the American Board of Pediatrics Subboard of Neonatal Perinatal Medicine, and vice chair and member of the board of directors of the Hippocrates Foundation, an organization dedicated to continuing medical education in the developing world. As chair of Department of Pediatrics, Dr. Ashner has overall responsibility for its research, patient care, advocacy, and educational missions. She has been a welcome addition to the Einstein-Montefiore family and has earned the respect and admiration of her faculty and colleagues. I present to you Dr. Judy Ashner.
Wow, thank you for that kind and generous introduction. I think even my greatest fan, my dad, were he alive today, would have marveled at that introduction. And I'm sure my family is as well. I'm so happy to have my husband of 36 years and an Einstein faculty member, Dr. Michael Ashner, and 2 of our 4 adult children here with me tonight. So, Dean Spiegel, Dr. Safier, members of the Einstein board, members of the faculty and the student body, and most importantly, members of the Albert Einstein class of 2019, and beyond for those MSTP students. I'm deeply honored to be standing here this evening, sharing this symbolic moment with you and your families. Your excitement and trepidation are palpable, and I'm not just talking about your parents. My goal is to offer a few words of advice and encouragement and share a few lessons learned along the way. Most of what I'll share with you is based on personal experience, because in the end, becoming a physician is very much about personal experiences and building trusting relationships. For your first 2 years of medical school, it's the relationships with your classmates and the faculty that'll provide the human context and sometimes some comic relief as you tackle the fundamentals of science and medicine and humbly grasp how much there is to learn and master. Many of the people sitting in the chairs next to you will become lifelong professional colleagues and friends. In the 3rd and 4th years of medical school, along with learning how to apply all that new knowledge swimming in your head, you will need to learn how to become a member of a team and to earn the trust of your professional colleagues and the other members of the healthcare team, especially the nurses, and of course, your patients. Medicine has truly become a team sport, and learning how to fit in, contribute, respect the contributions of other team members, and ultimately earn their respect as the team leader is an important aspect of your journey to becoming a physician. But ultimately, it is our relationships with patients and their families that bring these lessons home and transform us into physicians with the power not just to heal, but to touch people's lives when they are most vulnerable and to make a difference one patient at a time. I will share with you one of my stories tonight, but not quite yet. Because first, I want to take a moment to acknowledge your families and friends who are here to celebrate this important step in your professional journey with you. Parents, grandparents, take a deep breath and smile because you have much to be proud of. I remember how I felt when my daughter had her white coat ceremony. It was one of the happiest moments of my life. Your medical students have worked hard and accomplished so much to get here today. And the faculty and leaders of the Albert Einstein College of Medicine pledge to nurture them, provide course correction when needed, and challenge them to become the best possible physicians, medical educators, and physician scientists. And students, don't forget to thank your parents, your grandparents, spouses, and partners for supporting you and helping you to achieve the right to be called a student of medicine. And make no mistake about it, you will be a student of medicine for your entire professional career. And while you're thanking them, ask in advance for their forgiveness, for forgetting a birthday, for being on call at an anniversary, for missing that soccer game or family dinner. You will make many sacrifices in the years to come, but so will your family. Don't ever forget to let them know that you appreciate and need their support, and pay it back when it's your turn. When I was thinking about the themes and messages I wanted to impart today, I tried to stay away from the journey and destination theme, but the metaphor is just too perfect. You are embarking on an amazing journey to becoming a physician. Some of you have always known you would make this trip and have been preparing for it since childhood, knowing from an early age that medicine was your calling. For others, this ticket was purchased more recently and at great expense. Perhaps, like me, you took a more circuitous and uncertain route. But first year of medical school has a way of making all of that irrelevant. Regardless of your path here, you are now on this trip together. Get to know one another because you are bound together, a community of learners. You'll study together and complain together and party together. You'll eat and not get enough sleep together. You will learn who is the class organizer, the class clown, every class has to have one, and who quietly gets the work done. Who is generous with their time and their knowledge, and whom among you will ultimately excel as a master teacher, because all physicians are teachers. Practice that skill with your fellow classmates, because now you can afford to be generous. Remember that knowledge, like love, is infinite. Sharing your knowledge and understanding does not diminish your own. Rather, sharing knowledge enhances and strengthens your own. The ride on this long journey is not always going to be comfortable. In fact, I can assure you it won't be. The route may be marked by detours and delays. The passengers you meet along the way may not always be pleasant or appreciative of your best efforts to make their journey more comfortable and expeditious. Like most trips, it's best to plan ahead, but not too far in advance. Keep your eye on the destination, but don't forget to look out the window and explore the amazing places and people who share this journey with you. You may be surprised where it leads you. So my themes for tonight are opportunity and privilege, the privilege of becoming a physician. But first, a word about opportunity. So opportunity is defined as a set of circumstances that makes it possible to do something. Being a medical student at Einstein is an enormous opportunity. Seize this opportunity to do something meaningful. Stay open-minded, explore outside your comfort zone, and take advantage of the fact that you will be learning and working in an urban community plagued by social injustice and healthcare disparities. In an editorial by the president of the University of Cincinnati and the dean of the College of Nursing in Cincinnati, they wrote about the urban health disparity. And they said that the ultimate test of an academic medical center isn't what's inside the building, it's what's outside. If we're improving the health of the communities we serve, then we are truly succeeding. We need policymakers, prospective students, the public at large, and our peer institutions to work with us, because collaborating in the quest for health equity to prevent the preventable is the best medicine. And so tonight, I ask you to be that student and be relentless, relentless in the pursuit of excellence and equity. So I know it's cliche, but when opportunity knocks, answer the door. Nothing is more expensive than a missed opportunity. But opportunity is missed by most people because it is dressed in overalls and it looks like work. One of my favorite quotes by Thomas Edison. But please, don't be this guy. And for those in the back, I'll read it to you. It says, opportunity paged me, beeped me, linked me, emailed me, faxed me, and spammed me, but I was expecting it to knock. Because opportunities are never lost. Someone will take the ones you miss. And whenever possible, create opportunities for others. So I've been the beneficiary of many opportunities. Some were created for me, others were serendipity. All involved making choices and taking chances. All were important in my journey to becoming a physician. So now for a personal story that left an indelible mark on me, incited my passion for my field of medicine, and helped guide my professional journey these past nearly 35 years. As you heard, I'm a pediatrician and a neonatologist by training and by temperament. Neonatology is a fast-paced, demanding clinical subspecialty. The hours are long, the patient's high risk, and the neonatal intensive care unit, or NICU, is unpredictable. As a trainee, you either love it or hate it. I loved it then, and I love it still. And I'm a physician scientist, driven to the bench by the unanswered clinical questions in the NICU. To me, these activities are inextricably linked. I'm a better clinician because I do research, and my greatest research strength is my understanding and appreciation of the relevant clinical questions. My passion and motivation for doing research are my patients, and my frustration with the fundamental gaps in knowledge about the complications of prematurity and the therapies we provide in the NICU. And so it's natural that the patient story I will share with you tonight takes place in part in the NICU in 1985. But this story came alive for me again just a few months ago, on March 6, 2015, when I opened up one of the many hundred emails I seem to get each day and caught my breath. That email read, "Dear Dr. Ashner, my name is Carol, and I'm a general surgeon. I'm taking care of a former patient of yours, who tonight we will call Lisa. She is hospitalized with a small bowel obstruction after delivering a healthy baby girl. I asked her what her original disease process was that led to her first laparotomy, and her mother forwarded an email from you, dated November 1st, 2010, that details her illness, spontaneous intestinal perforation. I found it very touching, and as I read your email, I recognized what I've come to appreciate more and more, that it is our connection to our patients that makes medicine such a unique vocation. Your letter embodies the reason that doctors become doctors and why they persevere and why doctors should keep doing what we went to medical school to do, to make a difference in people's lives. So you can imagine my reply. It went something like, "Oh my, you just made my day." Of course I remembered Lisa, and I put that email from 2010 in a safe place, and now I will share it with you. But first, I need to put the story into historical and medical context. The year I wrote the email was 2010, but the story dates back to 1983 through 1985, when I was a pediatric resident and fellow. The border of viability was 24 to 25 weeks gestation. A full-term baby is born at 40 weeks gestation. There were no electronic medical records, a blessing and a curse. Drug doses were calculated by hand, definitely a curse. There were no duty hours for residents. My verdict is out on that one. And I pretty much lived in the NICU, just ask my husband. My patient Lisa was born at 24 weeks. Today, her chances of survival would be more than 75%, but back in 1985, they were less than 20%. But Lisa survived, and in 2010, her mother looked me up to tell me about how well she's doing and to ask me a medical question. So here's my reply to her mother. Dear Barbara, thank you for sharing Lisa's story. I have my own Lisa story to tell. I've been practicing neonatology for more than 25 years and have taken care of countless babies. But for reasons that I will explain to you now, Lisa is one of the most memorable of my career. I think you should know that Lisa did not have necrotizing enterocolitis, a well-known entity in neonatology that causes bowel necrosis and is often fatal, although I can understand why her pediatrician thought she did. She had a spontaneous intestinal perforation, or SIP. SIP is now a well-recognized disease in tiny preterm infants, but no one had heard of it in 1985. I wrote the first paper describing SIP in 6 infants, which was published in 1988 in Pediatrics. Lisa was the second baby anonymously described in this case series that introduced SIP to the world of neonatology and pediatric surgery. The first baby died because we did not know what it was. It was 2 years before Lisa was born, and I was the resident taking care of him. He was a tiny baby, even smaller than Lisa, and he slowly developed a bluish discoloration of his abdomen that became more obvious day by day. I asked the fellows, I asked the attendings, I consulted the pediatric surgeons, but no one knew what caused this. They were more concerned about the infection in his bloodstream that would not clear despite strong antibiotics. When he died, I sat with his parents and asked permission for an autopsy. They agreed in the hopes that we would learn something that might help another baby. It was a generous act, and it was that decision that saved Lisa's life. The autopsy showed a small hole in his otherwise normal bowel and an abdominal cavity filled with meconium that stained the tissues under his very thin skin, and we could see that on physical exam. I never forgot that baby. And so in 1985, when I walked into the NICU and saw the same blue-black discoloration on Lisa's abdomen, I was sure I knew what was wrong. I called the surgeons, the same ones I had consulted 2 years earlier, but they didn't remember the baby from 2 years ago, and these experienced surgeons did not believe Lisa had a perforation and were reluctant to take her to the OR. She was tiny and she was sick. I was just a first-year fellow at the time, and I was besides myself because I was sure she needed surgery. So I just kept paging them every hour on the hour, and generally made a royal pain of myself. So you see Dean Spiegel and Steve Safier. Things haven't changed since 1985. I told them I would keep paging them every hour until they took her to the OR. They finally got so fed up with me, they agreed. And I went with Lisa and the surgeons to the OR that evening. They were starting the procedure when they bet me dinner in the best restaurant in town that they would find nothing of significance. As soon as they made their incision, there was complete silence in the OR because, of course, they found meconium, that black-green first stool that babies pass, filling her abdomen. I never got that dinner, by the way. In the next 2 years, there were 4 more babies with similar discoloration of the abdomen and spontaneous intestinal perforation, and I wrote that paper first describing the condition. It's now a diagnosis that every neonatologist and pediatric surgeon recognizes, and there have been many papers written about it since. I also remember that the day that Lisa went home from the NICU, I looked up the phone number of the parents of the baby who had died 2 years earlier. And I told them that because they had agreed to allow an autopsy when their son died, another child had lived and was going home that day. That mother was so happy, and I will never forget that conversation. So, Barbara, now you know the rest of the Lisa story. I've written more than 100 papers since 1988, but this one, a case report describing SIP, has probably saved more lives than all the other work I've done put together. I even included the surgeon as a co-author. I'm really glad you wrote to me, and I'm thrilled to have Lisa's wedding pictures and to know she has done so well. So I have one more story that I want to share with you tonight. But this one's not mine. It was written by Michael Radetzky when he was in Denver. It was published in JAMA in 1985 in a series that was called A Piece of My Mind. And I read this paper, and it so resonated with me, it so touched me, that I did something that I am sure none of you in your medical career will do. I took that journal, I walked to the Xerox machine, I pushed down on the binder so that I could get the corners of the text, and I made a copy, and I put that paper in a folder that I call Special Things. I still have that folder. It's moved with me from institution to institution. And a few weeks ago, I pulled out that now yellowed page to share a somewhat abridged version of that article with you. For over a year, and I'll warn you, this is a sad story. For over a year, this infant had spent more of his time in the hospital than out. He had a form of histiocytosis X, but no one really understood the prognosis. We had all hoped for the best, that he would slowly outgrow his disease while we treated the interminable complications as they arose. None of us thought that he would die, but he developed a right-sided facial palsy. Seizures followed with coma and eventual brain death. 1 week before his death, the boy's father brought in a new toy, a stuffed dinosaur emblazoned with swirls of color. The father began to brandish the animal to evoke some flicker of interest from his comatose son. "Hey, bud, look, a dinosaur." Nothing happened. Then the boy's one good eye opened slightly and fixed on the brightly colored animal prancing so close to his face. A small smile tugged at the left corner of his mouth, and slowly his right arm reached out to embrace the toy. Within a minute, the smile faded, and the boy lapsed back into coma. We all cried. He died the following week without regaining consciousness. What fulfills the physician? Certainly the diagnostic challenge, the financial security, the altruistic glow, and the grateful thanks all provide a measure of satisfaction. But all too often, success becomes bracketed by failure. A deluge of new information erodes the sense of professional mastery. Money ceases to compensate fully for the time and the toil. The good one attempts to do goes awry, and the thankfulness of patients becomes admixed with fear and suspicion. No, for me, fulfillment comes from the sudden intimacies with total strangers. Those moments when the human barrier cracks open to reveal what is most secret and inarticulate. Illness strips away superficiality to reveal reality in etched detail. This revelation can fuse together desperate lives in unexpected kinship. Is it the fear of death, the dreaded pain, the sorrow or the loss? The physician who can see is there to share in it. Is it the joy of birth, of unforeseen recovery, of reunion with one thought lost? The physician who cares can rejoice even as a family member. Who else so often holds the hand, puzzles over the varieties of fate, and feels another's moment so personally and powerfully? And who else has a chance to realize that it matters less whether the moment is one of supreme sadness or supreme joy than it does that the moment itself is supreme? This is the physician's privilege, to be lifted out of the dross of common days in order to experience such clarity of feeling. The intensity of birth and death, pleasure and sorrow, as expressed in the lives of others, has the power to nullify personal boundaries in sudden communion. Then the world is seen in its proper proportions, and the tenuous miracle of existence is underscored. Surely it must profit us to feel this deeply, with the hope that somehow, in the sweep of that feeling, we might yet learn to appreciate the wondrous happenings of our own lives. So a few closing comments that take us back to the beginning of this keynote. One is, as important as having a career plan are the people that we have with us on the journey, and these are my people. And for families, vicarious pleasure is almost as much fun as experiencing it yourself. Yes, that is my granddaughter. And when it comes to medical school, it's actually more fun. And so I'm going to leave you tonight with my all-time favorite quote from that great philosopher, Mario Andretti. If you think you have things under control, you're just not going fast enough. Thank you very much for your attention, and congratulations.